Hi there, here we are with our patient Mark. Mark came here for a 7-month follow-up. Mark had 4 prior procedures where he had large grafts throughout the frontal hairline and the vertex, and he had an open area in the crown. And due to the previous surgeries, he was left with very unsightly suture lines. So the donor area wasn't closed, and so he had large scar formations, which made it very hard for him to conceal that with his hair. So what we did for Mark was we did a maxed harvest hair transplant procedure where we were able to move as much hair as we possibly could move for him in that one procedure. And what we did is just got whatever we could get. We went through the entire frontal hairline, reframed his face where we went through and kind of softened it up all the way around. We built into the center, and then we built into the crown. We're going to show you what all of that looks like in just a second. Alright, so let's take a look up close how Mark's hairline came out. So as you look and see here, this is frontal hairline, which has been recreated, all with one tiny little hair at a time, which are super soft and natural looking, so it blends in naturally to his existing hairs. You can see some of Mark's older styles where he had those plugs, and so what we wanted to do is we wanted to blend those in so they're not noticeable, and then just kind of blend it into the existing hair. So what we did is we did that the entire way around. And so we softened it all the way around, so it looks soft and natural, blends into the existing hairs. And then even further back, we made sure all the larger unsightly grafts that he had from the older styles just kind of went away nice and soft. Now let's take a look all the way around, and then we'll show you what that suture line looks like. Okay, so I'm going to just lean you back here for a second. Alright, so we did that one procedure on, and as you can see, we got them all the way in, the entire way through. We built a spiral through here, which feeds the direction angles of the hairs throughout, and then we just built in and around as far as we could go. I'm just going back here with it, all the way through to this vertex, all the way through there. Okay, now I'm going to bring it back here for one sec. So it blends into its existing hairs. Now I'm going to show what that suture line looks like. Alright, so we did a maxed harvest hair transplant procedure. Let's find the suture line here. Okay, so first I want to show you some of Mark's previous surgeries. Let me just adjust one second here. Mark had previous surgeries, and this is the previous scar. This is a scar that was not done here. Actually, Mark's here today for us to remove this scar that he had done before from his previous doctor. This is previous doctor's scar. So you can see there's no hairs in this scar. This was from the other doctor. Okay, so. And I'm just going to lean down for this. So this has all been done by the previous doctor, and this is how they left that suture line. Now, we did a procedure, and we're going to show you how ours looked, and you're going to be looking at this with us for the first time. So, our suture line, when we did the max size case, we started all the way up here, and now this is our suture line up here, right through here. So you can see this line here is our suture line. Okay. So, this is our suture line here, right through here, you can see that. Okay, this is his old one, old suture line, and then right above it, this is our suture line, right up here. So can you see the difference? So you can see how this is a nice, thin, trace line, right through here, is what we left Mark. This is our suture line, and let's take a look once again at the old suture line. That's what the previous doctors. Now, if it's not, suture line is not done under the right hand, unfortunately you can get these wider scars. And the problem with these wider scars, when there's no hair in that area, when the patients try to cut their hair short, they're not able to get it to cover. And so that's what happens a lot of the times. And then when they swim, they can't really hide it. And so let's just follow ours around. This is our suture line here. All the way around. So this is part of the old suture line. Okay, and this is our suture line coming right through here. This is our suture line right there, and then all the way to the edge. If we were just to make a crease in Mark's hair like this, we can make that this area here, which is his natural crease in his hair, look the same way as the suture line. So that's the suture line right there. So if it's done with the right technique and you have the patients follow their instructions, it should not come out looking like that.
So Mark's here today. Mark flew in just to have us fix the suture line. We're going to be correcting that for him today, where we're basically going to excise this old suture line for him and put him back in business.
Alright, the great news for Mark, he's only at 7 months, is this is actually going to continue to grow. So he's actually going to notice a little bit more layering and a little bit more thickness, believe it or not. So there's more to come.